Today, more adolescent girls and young women are taking part in sports. As a result, they have healthier self-esteem and self-confidence, healthier body image, and overall better health. But when winning is overvalued, the pressure to be the best may push some athletes towards unsafe practices that can lead to a variety of health problems.
The Female Athlete Triad is a very specific diagnosis that we find in women, female athletes who are exercising, who have an eating disorder or abnormal eating patterns, and as a result they lose their period. So the first part is disordered eating, the second part is losing their menses or amenorrhea, and then as a result of that they develop osteoporosis.
Most girls with Female Athlete Triad try to lose weight primarily to improve their athletic performance. The disordered eating that accompanies Female Athlete Triad can range from avoiding certain types of food the athletes think are bad, such as foods containing fat, to serious eating disorders like anorexia nervosa or bulimia nervosa. Because a girl with Female Athlete Triad is simultaneously exercising intensely and not consuming enough calories, she may experience decreases in estrogen, the hormone that helps to regulate the menstrual cycle. As a result, a girl's periods may become irregular or stop altogether. Low estrogen levels and poor nutrition, especially low calcium intake, can lead to osteoporosis, the third aspect of the triad. Osteoporosis is a weakening of the bones due to the loss of bone density and improper bone formation. This condition can ruin a female athlete's career because it may lead to stress fractures and other injuries.
The risk factors are mainly those that go along with risk factors for eating disorders in general. So girls who have a history of dieting, girls who grow up in a family where there's a history of an eating disorder, girls who are very type A personality, and women who participate in sports that really value thinness and figures like dancing, gymnastics, long-distance runners. They're especially prone to developing Female Athlete Triad.
Treatment for Female Athlete Triad involves a multidisciplinary approach that includes a primary care physician, psychologist, and nutritionist, along with a coach, trainer, and family.
There are many long-term effects. Once you get down to very low body weight, you really have no energy. Your performance as an athlete is really going to suffer. There are the stress fractures. When you don't have periods, then one of the long-term problems is infertility. You will not be able to get pregnant. And it can become very serious. You can have abnormalities of the electrolytes in your blood, and you can develop heart problems, and some women actually die as a result of their very low body weight and eating disorder. If parents notice that their daughter has stopped menstruating, if they have recurrent stress fractures, or if they're worried about the amount of weight that they've lost, the amount of extra activity they seem to be doing in addition to their regular sports, and also if they have really changed their eating patterns, eating alone, like I mentioned before, restricting what they're eating.
For more information about the Female Athlete Triad, please contact WellSpan Adolescent Gynecology at 717-851-1990. WellSpan Adolescent Gynecology offers services exclusively for girls through age 22 who need gynecologic care for menstrual problems, PMS, development disorders, and issues such as contraception or the first gynecologic exam.